Andrea, thank you so much for joining the Okotoks Podcast today.
Thanks, Carlin, for having me. I'm super excited.
Well, as I like to go on LinkedIn before I meet with my guests, and you have been with the Sheep River Health Trust it's coming on 13 years now.
It is. It is coming on 13 years. I've had a long career here with the trust, and every day is different, and that's why I think I'm still here after 13 years.
Well, we want to dive into a little bit about the Sheep River Health Trust, and one thing this is my third episode of
Exciting.
the Okotoks Podcast, so you're high on the list. So that's pretty great. But the one thing, really selfishly here, I've been living in Okotoks for 13 years. But what's helping me out with the podcast is just to see how many great organizations we have in Okotoks and area. We're talking in end area today because it's not just Okotoks you guys cover. But there's just so many great organizations, so many great businesses that donate back to organizations like yourself. And I don't know, it's something that it's actually, I think this podcast is selfishly becoming more about me and finding more out about this town and this area and the great organizations that we do have in this community.
There are so many amazing grassroots organizations doing amazing work in our communities that every day are just trying to provide for their clients, trying to keep their doors open, trying to make their mandates work. And we really see that happening in the communities. We really want to support those organizations as well.
Yeah, right on. So can you tell us a little bit, like, what is the Sheep River Health Trust?
Sure. Well, we are a local nonprofit. We started actually as an auxiliary group, a group of ladies who got together in Diamond Valley for the Oilfields General Hospital and saw a need to increase services and programs and equipment there. That was quite a few years ago. In 1994, we did become registered as the Sheep River Health Trust. We fall under Alberta Health Services, so we are an Alberta Health Services Foundation. There are 70 of us in the province, so supporting AHS buildings. We support the Oilfields General Hospital and the Okotoks Health and Wellness Centre. But we think that healthcare doesn't really start when you walk in your buildings or go to your doctor. There's a lot of pieces before you get there. So that's what we're trying to see is how we can support comprehensive health in our region. And that comes all the way from the foothills. So we start all the way Longview, Millarville, Diamond Valley, Okotoks, and kind of the catchment all in between. So kind of regionally how we see ourselves supporting.
Right. And you said there's 70 organizations throughout Alberta.
Yeah.
Wow. Okay.
Isn't that amazing? Yeah,
Yeah.
just the newest one came up in the last few years. Airdrie's new, Cochrane's new, and I think it's really showing that Albertans value healthcare in our communities and see AHS as a big part of that and want to make sure that when you get sick here in the foothills and Okotoks, that you can come into your local Okotoks Health and Wellness Center, see your doctor, get treated, diagnosed here without having to get in an ambulance and go into Calgary. That's what really we want to see, right? Our residents staying in our communities to get treated and supported.
Right. And I would imagine, like, for some of those people that are sick, that need to go to the hospital on a regular basis, would much rather stay local as opposed to having to go to the Foothills Hospital, which is just a nightmare to get to.
And the parking and the travel and then if you think to yourself, maybe it's winter, how do I get in? We have great organizations that support volunteer driver programs for those people who need to go in. But we really want to make sure that if you come to the Okotoks Health and Wellness Center, say you're a mother who is pregnant, maybe in their 6th term, having bleeding, we have a portable ultrasound here that we can diagnose you here and make sure maybe it is something more serious that you have to be moved, but maybe it can be treated here. And that's really what we want, to make sure that our residents can stay in our communities. We have a long commitment to the Rising Sun Long-Term Care, which is a beautiful facility out at Oilfields. But that is really to make sure our seniors can stay in our communities, that they feel connected to the communities, their families can visit them. Those are big parts of what we want to see in the foothills.
Now, is there a little bit of a hurdle for an organization like yours to Well, with our government,
Mhm.
and our healthcare system, like, you no doubt hear it all the time is, well, why is the government not just flipping the bill for this? And why do you guys have to be fundraising?
Yeah, absolutely. It's a conversation we have almost every day with donors, with sponsors, with patients who come in to talk to us. And I think you just have to think AHS is a large organization and they're trying to do the best they can in the province. But we want to make sure that, as I said, when you come into your local facility, that you're cared for locally. And that's really our focus. AHS can continue to do what they're doing, and there is concerns, absolutely. The system has falls and flaws in it that we all see. Um, and that's not a conversation that we all need to get into because we could spend days talking about that. But we want to make sure that we support our local nurses, our local doctors, our site managers, our pharmacy technicians in our hospitals so that when you come in, you can actually be treated there. Right?
That's perfect. Yeah.
Hmm.
Um, you guys have like, just going on your website, it just like there's it feels like your umbrella is quite large as to
It is.
what falls under there. You have this support wellness program, and
Hmm.
then you're also funding equipment. So it's not just funding new equipment and getting equipment into the hospitals and the walk-in clinics and well, the care center. What do we call that?
Yeah.
Urgent care. There we go.
Yeah.
Here in Okotoks, but you also have support and wellness programs that you're dealing with
Hmm.
as well.
Absolutely. So we have five pillars of support. If I can remember them on this morning,
Yeah.
medical equipment, community care programs, families, seniors, children, and youth. So we really look for projects that fit under that umbrella. There's lots that fit under there for sure, but programs is definitely one of them and how we do that. We really want to support those wellness projects in the community, and that falls everything from the health nurses here to laryngoscopes at the urgent care to we just did a huge diagnostic imaging upgrade at Oilfields General Hospital for $120,000 because that would never have gotten done.
Right.
So those are really important that we continue to look at those programs and how that supports our community.
Right. And there's throughout the calendar year, you guys do have quite a few different events, fundraising events. Um, I don't know if you came prepared to kind of walk us through a calendar year as to the events that we do have. They're
I do.
probably top of mind, but we'd love to hear
Probably.
those.
Well, we have our big one that's coming up, Radiothon, which is June 19th. It is our premier event. So we have run Radiothon for, I think this is our 12th year already. It actually started because our friends down in High River Hospital were doing the cancer care expansion, and we really want to support that. We don't see a line on the highway that we don't go down there. Our residents in the foothills go down to High River, they come here, so we really want to make sure we support both. So at that time we did a radiothon for them. Our first year we raised, I think, $23,000, and we've grown it since then, and we are raise about $75,000 each year. This year we have a change. We're here at the Okotoks Health and Wellness Center, so we have food trucks and donation centers here. And then we're out in Rona at the Diamond Valley, Rona, to do a barbecue and donation center out there as well. But from that, we support a lot of community organizations. So we've supported, if I can remember some, it's always putting you on the spot, right? Grief support programs, diabetes foot care programs, accessible playgrounds, seniors buses. So those things that fall under the umbrella of health and wellness. So that's where we really see that community support coming through. Then we also have two other big events. We have a big photos with Santa. Huge. We
Right.
see we
Right.
see about 900 families.
My family has been there on a
Yeah.
regular basis, yearly,
Yeah,
yearly,
there
I
you go.
should
I,
say.
I started it because I had little ones and I thought I can do this way better. So we do photos of Santa in November and December, and it's one of our most loved events. And we
Yes.
see lots of kids, lots of families feel those happy moments through that. We were lucky through COVID; we would continue to do it. And then we have our Avenue of Trees with that, which is fully decorated Christmas trees that are on display at the Best Western in Okotoks. And then we donate those back to families who don't have a Christmas tree. We wrap them up and deliver them out on December 20th and put them in people's houses and light them up. So those are our 3 events. We do lots of other individual fundraising, but we've committed to 3 events because we know everybody's out there in the community and we want to understand that other people are doing golf tournaments and galas, but these are ours and that's what we do. So.
Right. And now just to back up a little bit, let's go back to the radiothon.
Yeah.
The Eagle 100.9 certainly is a big contributor to this event for you guys. Yeah.
We had an idea 12 years ago and went to them and said, hey, 6 weeks, let's do this. And they said, fantastic. We were the first in the region. We really see ourselves as a community radiothon. So we say together we can make a difference, and we feel that. Each little piece comes together. Each $10 makes a huge impact. And this year we're supporting 6 organizations plus our own projects. So it's an opportunity to make your dollar go a lot further and have impact on quite a few different programs that support health and wellness.
Right. And it's so nice when it stays in the community.
Yeah.
Yes. Okay. What the photos with Santa? What kind of, I don't know if you're prepared to answer this, but what kind of money does that bring in for your organization?
Well, it does. It's a great fundraiser for us. We do come away with about $35,000 to $40,000 each year. There is some high expenses with it, as you can imagine, because getting Santa from the North Pole
that's
every
not
year,
cheap.
it's not cheap.
Yeah.
It's a good retirement plan for lots of people, I think. But it's a great fundraiser for us, and that money does support the Okotoks Health and Wellness Center with projects. Last year, we had a few projects here. This year, we're looking to put in a slit lamp. So a slit lamp is, you go to the eye doctor and you put your head in that.
Yes.
Yes, that's a slit lamp. So we're having patients here come with debris in their eyes or something happening. So the doctors would like a slit lamp to be able to diagnose them here instead of waiting till tomorrow morning when your optometrist is open and can go see. So that's a big one for us. So that funds into that program for sure.
Right. What's one way we can stay in tune with what you guys are doing? I know that it's kind of part and parcel as to why I started the podcast. Is sometimes Okotoks, we get all the news from Calgary if we're watching on TV, or we have the Eagle that we can listen to for music and some news and kind of keep in tune with local events. We have the Western Wheel, but not everybody does those things. That's why we kind of started the podcast, to bring awareness to organizations like yourselves. But what's another way we could stay connected with you guys?
Well, I think social media is such a huge piece these days. We are quite active on social media with what's happening in our community, projects that we're doing. We just don't ask for money all the time. I think some people think social media becomes just ask, but that's not what it is. It's about talking about, other organizations, what they're doing. It's talking about, this month is, Heart and Stroke Month. It's talking about community events happening and how we support them. It's not always just about us, but we do definitely highlight projects we're doing. We do lots of follow-ups on, we put this in. We put a floor cleaner in an oil fields, and what does that mean for the staff? So we do lots of closing the loop, we call it, with donors to talk about how those projects impact our communities.
Yeah, and no doubt there's more ways than just donating money that people can also volunteer and help out. Yeah.
Absolutely. Yeah, yesterday I was just out at a volunteer appreciation at Oilfields Hospital, and to meet all those volunteers, they are so active, so engaged in the community. There's everything from gardening projects to helping in the lab to being a wayfinder. We had a couple puppies, the Patches, the therapy dog was out. So, it's not always money. You can give your time and talents as well. Those are things that are invaluable to organizations like ours.
Absolutely. If people are in the position where they want to donate, what are some options for being able to donate?
Sure. Well, everything usually goes through our website, so sheepriverhealthtrust.ca. It's pretty easy. We do every donation over $10 does get a tax receipt because we are a CRA, and you can also phone the office 403-995-5400.
There you go.
But and if you wanted to, we have lots of directed donations. We have families who want to support palliative care at the Oilfields Hospital. We have families who'd like to support the health nurses. We have families who want to support the Okotoks urgent care. What that looks like for you, you can make those decisions. It does go into the ether of the Sheep River Health Trust. We definitely have directed donations in how we support individual departments and organizations within the foothills.
Right.
Mm-hmm.
Andrea, your spirit basically leads me to think that this is not just a job for you, that this is something more.
I don't think you're in nonprofit work because it is just a job. I've done this. I've been fortunate enough that I've had support of my spouse to be able to do this full time. Because sometimes this work is hard. You do parades and barbecues, and my kids are the ones that help me in the summers when I do office cleanouts and all the rest. I have a long history of volunteering. My mother was actually part of the organization that started the Kids Help Phone years and years ago. So
really,
I was always a volunteer there from the time I was little. So it's just been part of my DNA to do it. And I think it's really important that we show our children that our time makes a difference in our communities. I think we become busy. We've got soccer and hockey and going to dance and all the rest, but giving back into the community you live in is really important. And I think our organization shows that. We have a dedicated group of volunteers and board members, but I think you also see that in our constant donors and sponsors that come forward year after year after year to support our initiatives and what we're doing in the community because they believe in what we're doing.
Yes. Well, again, and your website really reflects those organizations, those businesses that are supporting you. Just went through there and saw that Tribal Connections had a hot chocolate fundraiser and Cobb's Bread also. And then
those make huge difference in our communities.
Yeah. No, it's no doubt you feel the support of the community, and even right from the mayor's office, right? She's the one that suggested that we get in touch with you to talk about it. So it's very nice that Tanya is certainly on board and sees the value of what you guys are doing. So thank you very much.
We were very fortunate. One of my first employees I hired when I took the job was Tanya Thorne. Actually, she was counselor and she was part-time here as our fund development person. And so she has a long love affair with Radiothon because she's the one who came up with the idea. So Tanya has a long spirit of community giving back. So do her parents, Rose and Crawford Thorne. So we're so thankful that she recognizes not only our organization, but how important other nonprofits and her effort to bring awareness to them is in our community.
Where's the office, your office, located?
Well, we're in a little corner tucked away at the Okotoks Health and Wellness Center. So we're really fortunate that AHS does support us with computers and phones and office space. So we're lucky that our fundraising can go right back into our community. We're not paying overhead of rent and all the rest. Our fundraising right now, we have a 21% admin cost in our fundraising. So that's advertising, administration, salaries, all those kind of things go into that. But the rest 79% goes right back into our communities.
That's perfect. That's great. Is there a story that you have that reflects what you guys do on a regular basis and helping people out? No doubt hearing the stories that people for cancer treatments no longer have to go to Calgary, but they can go locally, that it's comfortable. Seeing what you guys also, the businesses and the organizations that you're supporting, even through the Radiothon. I know that one of those businesses, organizations, I should say, is It Takes a Village. You're going to be working with this year. And again, just overwhelmed with the amount of great organizations. But is there a story that you have that you could share with us as to something that really solidifies what you do as an organization?
Sure. Well, I think to go back to It Takes a Village, they are an amazing group of people. Every year they come and present to us for a grant for Radiothon, and we want to sign up. They are so dedicated to what they do, and I think that's what we learn a lot is the dedication of the people running the organizations. They're volunteered. You look at Solace Grief Support, they're volunteer driven. They're doing so much in the community. As for a story, that's a hard one to put me on
For
the
sure.
page, but
Yeah.
I think there is definitely Oilfields. We uh, as I said, have a commitment to Rising Sun long-term care. Years ago, patients who were interested in wandering
Hmm.
away from Rising Sun long-term care couldn't be in the facility because we didn't have a way to manage them in that facility. So, people with dementia who have a tendency in the middle of the night to get up and walk out of a building, uh, Oilfields was not secure for them to do that. So we put
Right.
a piece of equipment in. It was called WanderGuard. It wasn't exciting or all the rest, but it made a difference for patients to be able to stay in that community. At the same time, we have a fun bus out there. We call it a fun bus. It's a seniors bus
Hmm.
that we bought 12 years ago. It's still running strong. But to go and see the seniors on that bus driving just through the neighborhoods and the communities, it reminds them, oh, you know, it's wheat season and I used to be a farmer and those make huge impacts for you. I love going to Rising Sun long-term care because I think all of us have a association what a long-term care facility looks like. And we've spent a lot of time and effort with staff there to make sure it doesn't feel like that. It feels like home. Um, the murals are painted on the walls, so it looks like you're going into someone's house from the outside. Each room is an outside door. So it feels like they're living in a home, in a community, instead of feeling like they're living in a long-term care facility. So Rising Sun has always had a piece of my heart because they just make such an impact for seniors in our community.
The bus is such a great idea.
Mm-hmm.
My parents are in their 80s. My dad is still driving,
Mm.
um, and they love going for drives
Yes.
out in the country, just seeing the sights. Seeing, yeah, my dad's he used to farm,
Yeah.
looking at the fields and just
Stop and
getting
look at the
out.
horses. Yeah. It's such an
Absolutely.
impact. Yeah. And we have an amazing spiritual care chaplain out there, Jonathan McKay, who spends a lot of time and effort. I think my phone is ringing, but there you go. He spends a lot of time and effort, having men's groups. And so men can get together in the community and have a conversation. He spends lots of times bringing in outside people to help, expand horizons and all the rest because you may live in a facility, but you don't want to live in a facility. So we want to make sure that experience for them and the families is really important. We have a big patient and family-centered care program down there. So making sure hospitals feel accessible, not like you're walking into a hospital. Name tags, all staff wear name tags with their name on it. So you can say, oh, hey, Carlin, how are you? It doesn't feel
Yes.
like you're in a facility. We really want to make sure that when you come into those facilities, you feel cared for and loved, and get away from the stigma of it's a hospital, right?
Yes,
Yeah,
for
so that's
sure.
really important.
Andrea, I thank you not only for your time, but what you're doing for this community.
Well, it's just not me. I have a big group of people behind me who are out there supporting. My board is so supportive. That's why I've been here 13 years, is because I've had people who believe in what I want to see us going for and doing and think, fantastic, let's do that. So I've been really fortunate in this job, but there's lots of silent warriors out there that are making a difference every day in the Sheep River Health Trust world.
Right. No,
Mhm.
yes, and no doubt a lot of volunteers. And if there's people listening today that want to be able to volunteer, what's the best way to get involved?
Sure. Well, our website does have a get involved. You can sign up as a volunteer right there. We do, Avenue of Trees, Photos of Santa, as I said. Photos of Santa is a fun one to volunteer at because you get to see
Yeah.
all the kids and the families and the dogs that come in and all the rest. So definitely you can sign up online. We're always looking for people to get involved. We have a small but mighty board and we're always looking for more people there. So lots of ways.
Right. I'm going to write a letter to Santa to see if
Oh,
he can maybe reduce his rates for us.
yeah,
We'll start a
he's a
letter
very
campaign.
popular guy, a
Oh
letter
yeah.
campaign. So
No,
yeah.
the Santa that you get is fantastic.
We're very fortunate.
Right. So the Radiothon, Thursday, June 19th, 9 a.m. to 6 p.m. on the Eagle 100.9. I'm trying to say that like I'm a radio guy, like just trying to I'm getting there, yeah. Last year, you raised $75,000.
That's right.
And wouldn't it be great if we can surpass that this year?
Every year we hope to. And with those donations, it makes such a huge impact for, the 6 organizations we're supporting, but our spiritual care program, our Music in the Foothills seniors programs. We have a large school meal program that we feed over 26,000 meals every year. So there's lots of opportunity that the Radiothon supports. So it's a huge one. It's lots of fun. We have a spin wheel if you make a donation, food trucks, or if you're interested in a hot dog down in Diamond Valley, you can head over to Rona.
Right.
Yeah. And we will have some we're also on Sun Country this year, so there'll be some Radiothon on Sun Country.
Oh, perfect. That's great.
So
That's great.
Fun. We're looking forward to it.
Well, I will work my way down there on Thursday, June 19th, and looking forward to spinning the wheel.
Yeah.
Thank you again for your time and for what you
Carlin.
do. And anytime you need anything from me, if we need to get you back on for something to promote what you're doing, please just reach out.
Santa. Maybe I'll find Santa if he could do it, right?
Yeah, see if we can get Santa on. We can take him to task right on the podcast.
There you go.
So thank you so very much. You have a great day.
You
and
too. Thanks,
we
Carlin.
will look forward to meeting you soon.
Thanks. Have
Take
a great
care.
one.